Having clinicians lead the response during calls for mental health crises instead of relying on police.
That's a proposal the city of Indianapolis unveiled today. So our very own Nikki Dementri joins us live in studio now.
So Nikki, what's behind this plan? What does the city plan to do?
Yeah, Mark and Megan, simply put, better outcomes when it comes to emergency calls for mental health. Now, it's an idea months in the making. City leaders are joining forces with community groups like Faith in Indiana, all with the hope of launching a new mental health pilot program.
Time and time again, we heard the need for a non-law enforcement response. Time and time again, we heard a desire for reimagining public safety.
Indianapolis community leaders say that need is a clinician-led response mental health team. And the hope is next year's city-county budget is passed because in it, Mayor Joe Hogsett has set aside $2 million to create such a program.
The truth is, we can no longer afford as a community to simply lock up those who are struggling with mental health or diagnosed mental illness.
Details remain limited, but the pilot will include 24-hour coverage from teams staffed with mental health experts and others. Now, if the budget is passed, the program is set to begin in early 2023.
We anticipate that they will start in a limited number of IMPD districts and respond to calls for nonviolent mental health episodes.
In March, Mayor Hogsett pledged to budget for this response team. Public support for something like this ramped up following the death of Herman Whitfield III in April.
This situation certainly renewed an already existing fire. It didn't create anything that wasn't already there.
Whitfield's parents say he was experiencing a mental health crisis when they called police for help. When officers arrived, the situation escalated and an officer used a taser. The 39-year-old was eventually taken to a hospital where he died.
Herman's case is a perfect example of that. If there had been such teams available, if they had responded, they would have handled it as a mental health crisis rather than a police call.
Richard Waples represents the Whitfields. He believes this program shows city leaders are listening. They filed a federal lawsuit against the city and 6 officers involved over the summer.
This is one of our demands that we've had in the lawsuit, that we want to see this kind of public funding for 24/7 clinician-led crisis intervention teams. And I hope it gets passed, and I hope that it's sufficient. And if it's not, then they need to put more money into it.
The budget is set to be voted on next month. Now, leaders today note existing programs like MCAT will not dissolve if the pilot program launches.
So Nikki, let's talk about what leaders with this program are putting together. Are they looking at other programs in other areas as they come up with a model for this clinician-led program here?
Yeah, in fact, they actually recently traveled to Denver, Colorado to look at one of those programs that is similar to the program that they're trying to launch here. The program in Denver is called the Support Team Assistant Response. It's also known as STAR. Now, this program operated since 2020, and similarly, a team made up of a clinician and a medic are sent to nonviolent mental health calls. Mark, Megan.